China's epidemic prevention and control efforts have gone through the most difficult period. The 3-year resistance is a marathon battle against the coronavirus. Saving lives has been the utmost priority. China has kept severe cases and death rates among the lowest in the world. Over the past 3 years, China responded to more than 100 cluster outbreaks. It all began with an unidentified virus first reported in the central city of Wuhan. The virus caused surging infections and deaths, which challenged the medical system. China took action, including to lock down the city's 11 million residents. Public transport and outbound travel routes were shut down in January 2020 ahead of the Lunar New Year. More than 40,000 medical workers and 300 medical teams from around the country traveled to the epicenter. Construction workers built new hospitals, community members conducted contact tracing, and volunteers delivered supplies. 94% of people infected during the hardest hit time were cured. But that didn't mean becoming less vigilant. Mutations of the virus brought new threats. Outbreaks of the Delta variant were recorded across 20 provinces in 2021. As infections soared overseas, China took action to prevent imported cases. Visitors from abroad were tested and underwent quarantine. Imported goods were thoroughly tested and disinfected to reduce surface transmission. But the fast-spreading Omicron variant would bring new challenges. China responded by adopting swifter and more targeted measures, including boosting PCR testing capacity and speed. Home quarantine was introduced for mild cases and international travel restrictions were eased. Since the beginning of the pandemic, China has issued 10 versions of COVID-19 diagnosis and treatment protocols. The measures are all backed by science and medical reserves. China has been accelerating the research and development of vaccines and medicines. More than 90% of China's population is fully vaccinated against coronavirus, among the highest rates in the world. The total number of ICU beds in China has reached 138,000. There are 80,000 ICU doctors and 220,000 nurses. China also played a positive role in tackling the global pandemic. The country had sent medical expert groups to 34 countries. China also provided 2.2 billion doses of COVID vaccine to 120 countries. To maintain social stability, China sought to reduce the economic impact of the epidemic. In 2020, it was among the first countries in the world to resume work and reopen businesses. Policies to support business enterprises were announced at the national and local levels. Over the past 3 years, China registered average annual economic growth of 4.5%, which is significantly higher than the global average. The country is transitioning towards a post-pandemic recovery. Travel restrictions are being lifted, recreational venues are reopening, and businesses resuming. China describes the battle against COVID-19 as a people's war. It's a race against time and also reflects the wisdom and unity of the people.